Hello, everyone. This is Dr. Shevchenko from Smiles by the Sea, and I do get asked some questions about dental implants. So I'm going to be giving you guys some answers on those. So I get asked these questions: what are dental implants and how do they work? So dental implants are an option to replacing a single tooth, or it could be multiple teeth. So they are basically one of the options to replace a missing tooth. And they work is that if somebody has a missing tooth, whether they needed the extraction now, like taking the tooth out now, or somebody was missing teeth from before, this is an option where it's a fixed option where the tooth stays in the mouth, is not removable, and you're able to enjoy the foods that you want to enjoy with them. Another question that I do get asked is who is a candidate for dental implants? So there are various scenarios, and there is a checklist of things that we go through which patient is a good candidate for dental implants. So starting medically, we look at the patient, how are you medically fit for the implant, for example? How is your bone structure? Are you taking any blood thinners? Are you on any medications which involve the bone? Because a lot of patients have a condition called osteoporosis, which does affect the human bone, and it includes your jawbone as well too. So we have to make sure that you are clear from that part. The implant specialist will also check with your medical doctor as well too, if needed, the clearance that you are a good candidate from that point of view. And then when it comes to the dental part, we want to make sure that you have enough jawbone to place the implant. There are also nowadays options to build up some of the bone. Some patients are candidates to build up more bone. So we are able to give you some, nice fitting implant in the area where you're missing a tooth so you can enjoy your foods. So another question that I do get asked is what is the difference between a mini implant and a full implant? So as the name implies, in case of mini implants, those are shorter and smaller, narrow implants. And because they are smaller and narrow, they do not take as much load as a normal tooth or regular implant would take. So those implants typically are done in smaller mouths, and also where we see the patient does not have a very heavy load or is not going to have a very heavy load, and those implants are going to be able to bear that load. So those are typically done, few of those, and then a denture will be placed on top of them. So they're indicated in patients which are missing a lot of teeth and they do not have a lot of bone as well too. So instead of having a conventional denture, which is uncomfortable and it moves and you're not able to chew the foods as well, so this is some sort of like an in-between option, have between a conventional denture which comes out and between the regular implants denture, which is the regular full-size implants. So the regular full-size implants are typically, they are the full-size implants. They typically are able to bear the load as your natural tooth would, and they can be placed in any part of your mouth, whether you're missing a front tooth, whether it's a tooth in between, or whether it's a main load-bearing molar as well too. And they can be done as a single implants or multiple implants, and they can also be supporting a denture as well too, in case patient is missing a full mouth of teeth. So another question that I do get asked is what is the process of getting an implant from start to finish? So there are a few different steps to getting an implant. So I'll explain two different scenarios. One scenario is where patient has a tooth in their mouth and is deemed not savable, so it needs to be taken out and hence replaced with an implant. So in that case, most of the times, the surgeon will take out the tooth, do a bone grafting. That's the piece that replaces when the tooth comes out, there's a hole left behind where the root of the tooth was. So we fill that in with the bone so the bone does not shrink and it leaves a nice wide bed for the surgeon to place the implant. So you will get extraction done, then you will get the bone graft at the same time. Then we will be waiting for 3 months for bone to heal properly. And then after 3 months, you will go back into your dentist or your surgeon, and we will be placing an implant, which is the body of the implant. And then we let it heal for 3 months again, make sure it's nice and solid. And then after 3 months, you will be getting a connector and a crown. So that kind of gives us a three-step process: extraction of the tooth, doing a bone graft, we wait for a nice healing for 3 months, then go back in, putting the implant body, then we wait 3 months again, making sure the implant is solid and nice to take the load, and then we restore the tooth, and you have a tooth that you can see in your mouth and you have a crown that you can chew on. In cases, the other scenario could be where sometimes if you do have enough bone structure there present, you could take the tooth out and even place the implant right away, so you save up some time. The other scenario is where you're missing a tooth which you missed from number of years, or it could be a few months. So in that case, the surgeon will evaluate you and that implant can be placed right away. Wait for 3 months for it to heal and then put the connector in the crown of the tooth. So it could be a two-step process or it could be a three-step process. Another question I do get asked is how long does a dental implant last? So dental implants average life is pretty much for the life of your life. There are some scenarios where implants can fracture, but this is rare. We have seen patients now with implants for 30 years coming up since the implants have come in and become more popular. And 30 years is the cases that we have seen now in patients with successful, beautiful implants. So implant basically can last you anywhere from 30 to 50 years. So I hope I was able to answer some of your questions on dental implants. If you need any other questions, if you have any other questions or you need more information, feel free to reach us at 603-926-8827. And you can also visit our website as well too, www.smilesbythecnh.com.